Yesterday, we recognized my brother's keeper and officially declared MBK Day in the city of Houston. Today, I'm joined by the Health Director, Stephen Williams, and Neobali Ama with Bloomberg, and I'm probably giving him a new pronunciation for his name, with Bloomberg Associates to dig deeper into the program's remarkable achievements on the 3-year anniversary of the MBK Houston Local Action Plan. It's no surprise our city, through the Houston Health Department, was one of the first in the nation to accept former President Obama's My Brother's Keepers challenge. And My Brother's Keepers aims to improve outcomes and expand opportunities for youth with a strategic focus on boys and young men of color. In the words of former President Obama about MBK, we need to give every child, no matter what they look like, where they live, the chance to reach their full potential. And that is what we are accomplishing in Houston. And here to explain more is the director of Houston Health Department, the bicyclist himself, and that is Steve Williams.
Thank you, Mayor. And yes, I do love to bike. I'm particularly fond of
riding. My house all the time.
I'm particularly fond of riding down White Oaks. Yes, with my 2 dogs.
I'm sorry, back to the program. MBK.
I forgive you, boss. My Brother's Keeper is a great example of where different sectors of the community have come together to give opportunities to boys and young men of color. We know the demographics regarding that population, but the untold story, I think, is the potential that there is in that population. Since our start, we actually started planning over 5 years ago, but started implementing our programs through a program called Houston Basics. We've reached 26,000 individuals, really looking at helping to encourage brain development. 700 school credit hours have been recovered to help students get back on track for high school graduation. We know what incarceration can do for a person's life after incarceration, and so 82% of our Clean Slate Cooperative participants receive criminal record expungements, sealings, non-disclosure, or identification restoration. Our out-of-school suspensions have gone down by 60% in the participating school. In another school, and I think you've heard stories about the lack of access to books and reading, books that were checked out went from 5 to over 1,100 in just a single year. In addition, 5,300 police personnel are undergoing training to reduce social distance between at-risk youth and law enforcement. These are just examples of some of the things that's going on in My Brother's Keeper, which is a collection of different sectors: education, law enforcement, nonprofit organizations who are committed to making a difference in the lives of boys and young men of color. We're grateful to have the mayor's support, to have the various council members who have contributed to this initiative's support. And I want to introduce to you Neobali Ahmad, who is from Bloomberg and Associates. He has spent some time here, and I have to disclose that Neobali used to work for us, but because he was doing such a good job, Bloomberg actually took him from us, Mayor, and now he's working with them, but he has national responsibilities for My Brother's Keeper. Neobali?
And making more money. Because, our employees under the revenue cap, we can't pay as much, and so Bloomberg picked them up, and I thought I recognized you.
Hardly home, but always thinking about it. I'm just glad to be here on behalf of Bloomberg Associates. There's a growing consciousness in cities across the country about the role that young men and boys of color play in the future of cities. And so we've been excited not just for the work we do in Houston, but the work we've done across the country and helping build that capacity. And so I'm thankful to both the mayor and to Director Williams for really being a thinking and doing partner with his team in communities. And we know the program is really young, but we're looking forward to the outcomes to come in future years. And so we've been focused on bringing evidence-based programming, to bringing a data and outcomes focus. We have to be serious about changing outcomes and changing systems. And so the team here in Houston stands apart from some across the country and making sure that that focus is front and center. And so we're looking forward to the future years. Again, the program is new, but as you can see that there's already some outcomes to date. And so we're doubling down on our commitment here and looking forward to staying even longer.
Thank you, Neil. Let me just say this program is working, and the data speaks for itself. This is not just about a feel-good program. It is actually working, and one of the most successful programs in the country. In fact, it's serving as a model for other MBK programs throughout the country. When you're talking about in a short period of time, 26,000 kids, students being impacted, and the number of credit hours, the reduction, the number of expungements that they're dealing with, their interaction with police, the program is working. And so we have the hope is that we can continue to get the necessary resources that we can put into the program to even expand its reach, because that's the critical component. When you combine the MPK program with our summer youth program and then adding to the community engagement in areas that have been underserved and under-resourced, we can really make a huge, huge difference. So I want to thank Steve Williams and everyone affiliated with this program. Vice Mayor Pro-Tem, I know you've been working, you're actively engaged with it. Why don't you come and say something about this program?
Thank you all again, Mayor, Noel, Director. Thank you all so much for putting this program into effect in Houston. I'm here because it affected my district, District B, the Wheatley area, and it's no secret that we're going through struggles now in the city of Houston with HISD, with this school. And if you look at the numbers and the interactions that they've had, we would be in a worse situation if it weren't for MBK working with those kids. So thank you so much for, on a small scale, just helping with the suspensions, giving kids something to do every day, hope, pushing forward. So I want to say thank you so much, and also with the Cashmere High School. So it's a great privilege to be a part of the MBK program in District B within the city of Houston. And again, like the mayor said, we're looking forward to doing more, and I can't wait to see what the outcomes in the years to come.
Thank you. So from Northeast to Sunnyside, we're working to make a difference and building our city by saving one kid at a time. Okay, so I'm very excited about this MBK program. Any questions, comments?
Where do
Mike?
the resources come from for this, and are they sustainable to ramp it up as they come?
Well, come on, Steve, you want to come on? You can be more specific than I can.
Primarily, the resources for my brother's keeper are coming from the 1115 waiver program that we have. But when you really look at the overall contributions, what you're going to see are contributions from various city and county departments, because we didn't go out and recreate the wheel. We really wanted to leverage the resources that we were adding to the table with resources that were already there. For instance, one of the things that we're doing is providing wraparound services in a couple of schools. We're leveraging our resources with protective services from the county in order to do that. We didn't recreate that program. We knew they were already in the schools, and so we did that. Communities in schools run a program called the XY Zone program. It's an evidence-based program, and so we're leveraging our resources with them in order to carry that out. And so this is not a matter of just bringing more city staff on within the health department to get this done. This is a matter of really looking at the various partners that are out there that are doing things that we can leverage some resources in order to expand their reach. For instance, Big Brothers Big Sisters is one of our mentoring partners.
The 1115 waiver is winding down, right? So where are the dollars coming from to replace that?
That's one of the things that we're looking at, and that is a challenge. I feel comfortable for the next 2, maybe 2.5 years with that. In the next couple of months, what we're going to do is to look and see which programs will be core to MBK and maybe continue that. But we're, applying for grants as we normally do. A good portion of my budget is grant funded, as you probably know. And so we're seeking resources. We're also looking at services that are in a position to be reimbursed by third-party providers. Case management is one of those examples of that. Another initiative we have, our C to Succeed program, where we provide eyeglasses to kids, and we've seen remarkable results in attendance and academic achievement of those kids who actually fail their screenings. We're really working hard trying to put the infrastructure within our department to actually build Medicaid for that service.
I will say I just signed a grant for both MBK as well as Big Brothers Big Sisters that hopefully we can be successful in how the two are working together. And then it's always good with Bloomberg also being a participant. And then after 3 years, I think we have sufficient data where we can reach out to other philanthropic endowments and others and say, look, this works. And so now with this data, and one of the reasons why we're coming before you is that 3 years ago we didn't have this data. Now we do have the data. And so when you're looking at evidence-based programs that are making a difference, now we can go to other endowments and other philanthropic interests and ask for their support to continue to provide these programs and to expand their reach. Any other questions? Okay. Again, let me thank all of these individuals, and I know there are many different. How many partners are we working with? Because when I've spoken in the room, there's a room full of various partners and organizations. So
about 150.
Yeah, so it's about 100, working with about 150 different partners. I know Gulf Coast Community Association Services, Harris County. So there are a number of organizations that are working. We're leveraging our reach by leveraging our resources. But the point that I want to make is that I'm all in on this, on MBK. I know it works. And when I'm walking and out there in the streets, whether it's in Vice Mayor Pro-Tem District, Jerry Davis District in Northeast, whether it's in Mayor Pro-Tem Ellen Cohen's area, or whether it's out in Councilmember Boykin's area in Sunnyside, this program actually changes young folks' lives. And we need to invest in it, and I'm hoping that people will come take a look at the data and be willing to contribute to the program. Okay? Thank you all.